this is wound complications from your late effects of radiation. And so, as I'm sure many of you guys know by now, and it was good for me to hear sort of your, where you are in your treatment regimen, because that sort of tells me where you are in your responses. So radiation has a lot of different effects on the body, and it's mostly divided into time categories, either early effects or late effects. Right? If the response within your body occurs very quickly, days to minutes, we call that an early effect. That's much like getting a sunburn and go outside for the day. Right? That happens pretty quickly. You know that you had a body response to UV light, which is a form of radiation that's coming from the sun. So one of the earliest effects of radiation is erythema, skin reddening. And those of you who have gone through treatment, I'm sure you notice the number of changes in your skin as that was happening. Months or years later, we call it a late effect. And so a lot of wound development is going to come in the later effect pieces. So this is where, if you guys have skin questions, I'm happy to answer some skin, or if you want more wound information, we can talk about wound pieces. But more of your wound is going to come from the late effects. So it will come once you have had radiation for probably 2-3 months, once you're into the later phases of your treatment, where you will begin to see some of the blistering and things like that occur. So what are the odds of having a late effect of radiation? So this is going to vary person by person, but the general rule of thumb is that 5 to 10% of survivors, meaning surviving through the treatment cycle, who receive radiation therapy are going to have some sort of late effect. And this is going to be different for everybody. It's often based on age. It's based on the dose that you received of your radiation that was calculated out for you that was necessary. And it's based on the site that you had it at, even. Because areas that have less thick skin around the eyes and things are going to be more susceptible to skin breakdown than a much thicker area of your body would be. So all those things go into play, as well as genetics, right? Even the most healthy athlete runner in the world can sometimes have cardiac disease, right? So it's very similar in that regard. So sometimes your genetic makeup will play into how does radiation impact your skin. So the two most common wound complications, and this is what I chose to focus on because of your head and neck, the specificity of the cancer type C head and neck. The two most common that you could see are going to either be osteoradionecrosis or what they call soft tissue radionecrosis. And you will hear those abbreviated ORN or STRN. Osteo, medical word for bone, and then the radio is your radiation, and necrosis is deterioration, which can sometimes lead to death of the tissue. The most common area that you will see that is the jaw, for those of you who are going to have radiation concentrated to the head and neck area in your jaw region. Then you will hear people call it mandibular osteoradionecrosis or even MORN. Some of the doctors will just refer to it as medical lingo, we like to say ORN, or refer to it as MORN. So soft tissue, the difference between the two is one just simply means it has not involved the bone, it's just the soft tissue. We've not gotten so far as to begin to break down bone. Now, the reason why radiation interacts so differently in your body is because your tissues are comprised, your cells are comprised of so much more water, lipids, fat, that all of our cells that make up our tissues are comprised of all these different ingredients. And it's more dense depending upon what part of the body it is. Bone is much more dense than tissue. So bone interacts with radiation differently. And so for that reason, it's going to absorb more of it. So why does the tissue even break down? The small blood vessels are the key to the whole thing in your body. The little capillaries, the little tiny ones that are feeding the surface of your skin. The lining of those capillaries become inflamed, and when that happens, it starts to constrict and restrict down. That means less oxygen is going to our tissues. And when it's not getting the oxygen it needs, it's going to stop tissue growth. The normal tissue becomes replaced with dense fiber because it got damaged during its cellular cycle. if you go way back to your biology days, or not so way back to our nerdy, you guys remember that all the cells in the body split into die, right? They all go through mitosis and meiosis, one way or the other. Now, depending upon where it receives radiation in that split divide cycle, it might not have time to repair. A lot of our cells repair themselves. That's why when you get a scratch, your skin will regrow right on top of it sometimes. The scab will fall off and everything looks good because it repairs. But if it got damaged too close in that cellular cycle, sometimes you will have cell death, which means when it splits, it didn't split well. It split, and then the cell chooses not to regrow. So then is where your tissue begins to break down. You will get what looks like an ulcer. And these take different shapes and forms for people. And now, I don't know, I didn't include too many pictures because I didn't want to, I wasn't sure if you guys want to see them, didn't want to see them, so I do have a couple of pictures as to what it looks like in the mouth particularly. So this is Osteoradionecrosis stage 1 to stage 2. When it reaches stage 3, it has involved the bone, and it goes up there. So you could see exposed bone sometimes. So sometimes this looks like the spores that you get, like they call them stress spores, the little ulcers in your mouth where you have to switch with peroxide and stuff. It will look very similar to that, except you can't pull it. And that's what it will look like on the inside of your mouth. No, not typically. Now, we can heal them, obviously, but it's not going to go away with the peroxide, I guess I should say. It's going to involve much more detailed healing. I think your dental health through this process is going to be hugely important in order to keep everything as intact as you can. And we'll talk just a little bit more about that as we get into it a little bit. Because there are things that the more knowledge you arm yourself with, the better off you are when you go to your dentist later after your treatment cycles are finished. Because again, we're talking of late effects, so these are things that can impact your body years later. So once you have finished your treatment, there are other things that will keep you at risk for having this kind of skin breakdown. And again, I chose these two specific types because they're inside the mouth, and these are typically what head and neck cancer survivors report that they deal with. So your nutritional status, which lends us back to that G2 discussion, right? How well your nutrition stays up and how hydrated that you are. If there is any continued tobacco use and alcohol use, it will up your risk factor for having the skin breakdown because alcohol is a dehydrator. Okay? And so it takes a lot of the water out of your system, and so those things will make you more at risk, as well as tobacco. Tobacco is more of a, I hate to say, oxygenator. That's not the word I mean. But it prevents the hypoxia agent, right? It prevents the oxygen and constricts your vessels. So tobacco use will up your risk. The proximity of the tumor to your bone and teeth structures. That obviously depends when you are going in for your radiation treatment, and it pinpoints that radiation so wonderfully as they do. The closer that it is to some of your teeth structures and your jawbone, the more likely the risk factors go. So I want to talk a little bit about treatment and things that you can do. Okay. So what a lot of your physicians will prescribe, because they're very familiar with these after effects. So you will sometimes, if there is an infection present, they will prescribe antibiotic therapy. I have seen people from as much as oral to as heavy as IV antibiotics, depending upon the severity and how long they kind of let it go before they saw a physician. So, I'll just power. So if you see these things and you're questioning what they look like, by all means, consult probably your radiation oncologist, I would say, because I would say they are very familiar with what these things look like and having dealt with them in the past. At our wound care center, we do sometimes do debridement, which is where we go in and kind of scrape away some of that non-viable tissue to promote healthy healing. Your healthy tissue has to be stimulated in order to grow. And so sometimes that's why they say when you're a kid or your mom goes, let it bleed a little bit, it'll stop, right? That's where that let it bleed comes from, because when it bleeds a little, we are stimulating vessel growth because the vessels are in action trying to get oxygen and stop the bleeding. So if we make it bleed, it's working. They're getting up to the surface to try to clot. So that will promote healthy tissue growth. Surgery, sometimes necessary. It just sort of depends upon how severe it is. How bad did the sore get? Did it continue? Did it stop? And when that happens, sometimes they'll go in and graft. Very severe cases, they have had to go in and remove pieces of the mandible. But again, this is very severe. It's not typical.
What time frame does this happen in?
I have seen it in as early as probably 6 to 8 months after, and then I've seen it as much as 4 or 5 years after for people. Because latent effects are so different, right? That's why we say age plays a role. How old are you? Are you young when you had your cancer, so that as you age, your probability of being alive continues to affect your greater, right? So age does play a role. Now, sometimes people, obviously, it's just a 5, we're talking 5 to 10. And genetics, all these other pieces. Nutrition, all that stuff is so important to stay ahead of the game. So a lot of people never have any issues, right? Unless they go in much later to their dentist to try to have some work done. And that's where being all those questionnaires we fill out for healthcare becomes so important, because when you tell your dentist, I have had neck radiation, right? If they go in to extract teeth, or they go in to do things later on down the line in the coming years, they need to know that you've had that, because your muscles, and like you talked about, your muscle strength, same thing up here, your tissue being muscle, and all the muscles in your jaw and even your bones become weakened. So when you extract those, you're at a much greater risk for having an infection, disease.
Yeah, it was under a crown, and it was, we think that we had a cavity in it.
Sure.
And it started bugging me after treatment about a year after, or a year and a half, and I was like, okay, I just kind of put it aside, do this, and so I told it. My mom said, I don't want to use it, and they think it if you want to end up, and I'm on my job program right now. And so he said, what do we do? But, yeah, I got a little bit of bone, and I got the neck, so guess what, you're not getting any implant. Or maybe a year or two, maybe. Because the bone and the tissue and the muscle, the more support, when you're on it. Right up to where you're saying, like, that's what they said, you know.
No, it's very, that's very
That's
true.
my first question. I guess it is, it's like, look at my teeth.
Yes, your teeth are so important, and that goes into all these, it's overall health, right? It's spiritual, holistic, it's all those pieces in addition to nutrition and vision and all those other pieces that we have to take seriously. Now, there are things that we can do proactively prior to extractions now. I don't know how long ago you had your tooth issue.
In the last 6 months.
Oh, wow. That's very recent.
Yeah.
A lot of oral surgeons are really, and especially I think the one that is more affiliated here, Dr. Lowe, he's fantastic, and he utilizes our program quite a bit. Hyperbaric oxygen therapy can really minimize your risk, because what happens is it's not the extraction, it's the healing afterwards.
It didn't heal.
Right.
It was rough. I had to have it. It's incredible when you
Sure.
around.
Yeah.
I'm like, oh, why does that feel funny? And we went away, and it was gone, the crown was way in there. That is not good. So the next day, they saw me. So it was rough to get out. I mean, it was brutal. But then it didn't take blood for like a week. No restoration. And then,
I bet
it would not heal. And I don't do that. I mean, my body heals in general pretty quick. I go, it's not cancer,
because that, again, it's not pregnant.
You know, I know she's 257 years.
Right.
It's interesting. Like, great, here we go, teeth.
And that might be a great situation for Dr. Lowe for a topic, maybe sometimes just overall dental. Could very well.
Yeah. I had my son, it just popped up like a balloon.
Oh, wow.
And I came here to the emergency room, and they didn't know what it was, and gave me antibiotics, and I I went to Dr. Lowe and he hadn't seen it. And so, no, he hadn't. And so I went to UCLA and he sent me back to my surgeon and he did surgery, took it out, and he fixed it, did a biopsy, and took the sore thing like that.
Wow. Oh, I wonder what made it was it the antibiotics?
I don't know. No, I didn't have it.
I wonder what was the infection that made it destroy.
I didn't have an infection.
Oh, there was no infection that way?
Nothing I know of. They didn't know where it was in the emergency room.
Sure.
They gave me antibiotics.
Probably as a better safe than sorry, because that would have been my first instinct too, was to think that there was some sort of infection underneath that probably.
That was about a year ago. And then I had 2 teeth that was broken off just a tiny bit, and went up.
Well, if the radiation for you had been, I don't remember where your site was, where your radiation, where you were all right around in that area. Yeah. It just sort of depends upon how your body, again, responds and then how strong some of those tissues are prior.
And once you miss your teeth and in the early days, they'll pull their teeth out and give you dentures.
Right.
And do surgery and all that.
Yeah, they don't do that as much anymore as far as
Definitely they'll catch up to you. I mean, that's going to be haunting one. Is jawbone. If your jawbone is like 40 years old and you've done it 4 weeks or 8 weeks. Early, yeah. It's rough. You don't die, but you get sick. That's really all it is.
The mandible is the most involved bone, obviously, just because of its placement and how dense it is. It is one of the stronger bones, not very easy, unless you take a full-on clock to the jaw, not too easy to break, and so it absorbs radiation at a much higher rate than most other tissues around it. And so that's part of why the breakdown can occur underneath the teeth and things. Absolutely.
What do they do if that happens? Do they do a bone graft?
They can. But again, that's the severity piece. Do you have to have surgery? Is it something where they can just sort of repair the skin above it? Is it not involving the bone, but just the skin too, where the bone is exposed? How deep is it go? And those are all things that you're not probably the surgeon that's involved very heavily with oncology patients, which from my experience, I know Dr. Lowe is, and I don't know about a lot of the other ones. Here in Orange County, we have several oral surgeons who I have had meetings with trying to educate them about this so that they are aware of the different things that we can do. Let me look to the next. I may have reordered it, so I don't know if it's right here. I'm going to talk just briefly with you guys about HBO, and then that is what our machine looks like. The hyperbaric oxygen chamber, and the next set is not the exact chamber, but that's the same thing Michael Jackson was sleeping in. Right? There's nothing right? About him sleeping in these pressurized chambers. That part is true. It does deliver oxygen at a pressurized rate, so similar to scuba diving. You do go down to a depth and then come up to a depth. So once you are at the atmospheric pressure we need you at, we leave you there, and then it takes about 15 minutes to travel up and about 15 minutes to travel down, although you're not really moving, right? It's all happening inside the chamber. That is what they look like. We can talk to you. You can watch TV. They're very open. But these things deliver oxygen. It's almost like force into your tissue. So your tissue will take that in. And what HBO does is stimulate your blood vessels to grow. Very similar to where we would go in and sort of prick the tissue to kind of make it bleed a little bit. It's that same thing. It brings those vessels to the surface and forces them to do what they're supposed to do to help your wounds close.
You find people anyway who get do that. You find that they got to be healing quicker.
Yes.
They have to be.
They sure do. And it sort of depends upon all diabetics, but also the people along those lines will go into these chambers as well. People who are experiencing what I call the ORN, whether it's ST or jaw or soft tissue or not, that population we tend to pre-treat. We'll maybe do 20 treatments before you have any dental work done. And then you'll go have your dental work and then come back and we'll follow up with 10 15 treatments after to help stimulate that growth. And we'll pre-treat sort of the area before they do any removal or basically trauma to the area. Because that's where your trouble comes, is how you heal after, right? That's the problem. So we will tend to pre-treat with the hyperbaric oxygen.
Is that considered acceptable to most insurance?
If you have the diagnosis of osteoradionecrosis, it is completely reimbursable by our insurance. Not withstanding the deductibles on that piece, but all of that kind of thing is covered. It is a Medicare approved indication, absolutely. And that is where we've seen so much success. There's actually a dentist, last name is Mark, who refers to the Mark protocol, where we will treat prior and then we'll have your dental work, and then we will treat a little bit after, depending upon who your surgeon is. And these treatments are from daily, right? We are not open on Saturday, Sunday, so Monday through Friday you come in, whatever time we set up, and you 2-hour increment. You're at depth for 90 minutes, and then 15 minutes of travel, 15 minutes up, so it's a 2-hour time frame. Sometimes we will break up those treatments. It just depends. And again, bearing in mind, this is something you might not need for eons down the line, but just to know it's out there.
Is your oxygen level when you're down in the lowest level, let's say with the most oxygen, like what is that comparable to, like sea level or Death Valley or something like that?
It would be, you would be probably about 30 feet below sea level.
Really?
So it's that pressure sensation. So the most things that people will talk about when they're in the chamber is just kind of clearing their ears. You know how when you're in a plane or you're climbing the mountains out toward big bears, you have to sort of swallow and make your ears pop. The same sensation. So ear pain is really the only issue people have ever associated with the chambers. And usually it clears on its own, typically.
Well, you can't think of it sound like it's that much. I mean, it would do something, but I guess it's just like you're saying, it's the pressure is pushing through.
It's the pressure, and your skin just absorbs it right in. And women, it is true, you are a little extra glowy when you come out. I've seen women come out, and I'm just like, wow, I don't know about your woman, but your skin looks fantastic. You know, and there are a lot of benefits to it. And so in the years to come, I'll be very interested to see where this technology goes. Absolutely. It just happens
Before
so
you get
rapidly.
married, you go in.
Then we'll extra time.
Any chamber at home is going and shows up.
So the way that works is it's stimulating those small blood vessels to grow. And as you guys remember, your red blood cells are what carries your oxygen through your body, right? And so it has all those blood cells that are running through your body have increased levels of oxygen. And so your stem cells get activated, all kinds of really cool things are happening beneath the surface, and that is where you get healthy tissue growth. And so diabetics, especially, they feel a lot faster with the use of hyperbaric oxygen.
Can we use it for, like, burn victims?
We can. There are some burn things that are applicable to go in there. Usually, most of the insurance carriers have like a treatment protocol that they want to see followed prior to using something like this. But if they have no response, the same thing with the ulcers. If your ulcer hasn't responded, like with a 30% decrease in size, then they will all pay for hyperbaric. Absolutely. So it just sort of depends upon what insurance and how bad, the things are. The MORN, your mandibular radionecrosis, or soft tissue are automatic approved indicators. Because it's really helpful, especially if you are aware and your dentist is aware and everybody knows that these are possible complication issues. This has been pretty effective in helping minimize everything later and helping everything to heal after you have extractions or implants maybe, right, whatever, depending upon what needs to be done. We talked just a little bit about nutritional support. So there are things that you can eat. Your special diets notwithstanding, right? I don't want to cross into those toes. And I do believe actually if Denise has not already done it, you guys are going to have a lecture on nutritional support, right? So, but the 4 main things that will help your wound: protein, vitamin A and C, and zinc. And underneath those are just some examples of what those foods are. And these particular things will stimulate stem cell activity, and they will stimulate red blood cell production and stimulate oxygenation. So if you are a kind of a whole body mind spirit person, these things all matter. They really do. Sure.
Now, it seemed like when I was at Dr. Cox's today, they were mentioning that I should not take any vitamin A supplements or vitamin C supplements.
Sure. And that might be contraindicated to the chemo or anything that you might be about to have. And so that's why I say special diet restrictions notwithstanding.
So from the food, they said it was okay, but...
Okay.
So the food is okay. Okay, that's something to remember.
Right.
It's not the supplement.
Right, not to take additional.
So for me, since I don't eat much treatment, would that be okay to take a supplement instead of all its food?
That's a good question. And that one I would probably leave to a physician's recommendation. How long have you been out of treatment?
20 years and a half.
I would wager that you probably could take some supplements at this point, but again, I would check with your physician before I made that decision. Because you don't want to do anything that, especially if you're having, I think you said you were seeing another physician soon, right?
I'm going to see Dr. Rowe and Dr. Church tomorrow.
Okay. Oh, both of them.
Well, Dr. Rowe, I can be into
Yeah, I would, if you're seeing Dr. Sir, I think it's the card, I'm trying to find his name correctly, then I would probably ask him tomorrow to be sure. That way you're safe. But these types of foods will help stimulate some of the things that your womb needs to close.
I have had a little sore under my tummy too, and I've been to go to a, oncologist, so.
Yeah, it definitely so.
But
But you never know. You never know. Like I said, if it's soft tissue related, it could just be some of the tissue breaks down, but these things, again, there's stuff out there that helps treat it. There's wrenches and things that you can use to try to minimize the impact to your daily living. So definitely, if you've got something that you notice or something that's popped up, point it out. Point it out to them.
the sores, sometimes they're really bad, and other times they're not as bad.
How
I
come?
usually would do the mouth wash, taking something that not really helps them. They can get really sore.
Oh, absolutely. And there are a number of things that impact that, right? Not only your diet, but if you have had a heavy acidic diet, that can sometimes make those worse, right?
Yeah, I was just going to say, I mean, like some of your citrus juices and tomatoes and peppers and aren't those kind of hard on your throat too?
Oh, yeah.
Take a while, and you jump on that.
Yeah, these are things that you would work back in later.
Maybe eating a tomato before you want it, but
Yeah. Yeah. Some of it, I mean, this is stuff that you can work back into your diet much later. Right? These are things that will help if you get delayed effects.
Right.
Delayed effect issues. So while you're going through treatment, I'm sure none of them will be appealing properly. So quite sure none of it will last. You're not going to want to have most of it. So skincare. This is just kind of the basic do's for your skin while you're starting treatment. I've tried to cover sort of both ends of that spectrum. So you should be looking, especially the areas that you're having radiation for dryness, cracks, sores, right? Redness, blisters. Don't stretch or port your skin, right? Because it is getting thin throughout this process. So try not to tap and pull at it if you can, unnecessarily. Always rinse well when you're showering. Make sure you get all the soap off your skin because some of that residue left on will help contribute to the dryness. Moisturize, especially the other areas of your body. Right? Not just the area that you're having radiation. So moisturize all of your body if you can. I would buy buckets of those lotions and just really try to put it on as much as you are able to because it dries you out. When your chemo is going to dry you out, that's why they say drink water and be hydrated because you're not feeling well, and it takes a lot of that out of you. So try to keep your skin as hydrated as you can to keep your skin healthy. For very dry skin, you can use all of those shea butter lubricants. Those will help put moisture back into your skin. So the things that are made with shea butter are usually precursors. And I feel like that I kind of have paused quite a bit of information here. So going back to tooth extraction, right? The odds of getting the osteoradionecrosis, we've talked about this already a little bit. This increases many times over because you're going to have trauma to that area. They're going to go in and pull out a tooth or go in and do some dental rework or whatever it is that you have to have done. So that just makes the possibility of things not healing and maybe an ulcer forming, I would probably say 6 or 7 times greater than you developing that on your own post having treatment. So knowing all this stuff ahead of time and knowing the questions to ask are really going to be helpful, I hope, for you all when you're having these conversations with your dentist.